And putting Singaporeans' health first, a white paper recommending free vaccinations, screenings and new subsidies for medicines has been submitted to Parliament. Well, let's stay on that topic and for more, we're joined by Tay Choon Hong, CEO of the Health Promotion Board, to speak with us. Welcome to the show, Mr. Tay. I'm just curious, right? How are the existing SG offerings that are on your platform right now differ and even not cannibalize, what's already there, or what you're going to offer? Okay, let me rephrase that. You have plans for HPB. How does it not cannibalize what's already on your platform?
The way we think about this is really expanding into new population segments that may have not been part of our platforms for various reasons, right? So if I look at the number of downloads on the Healthy 365 app, it's about 700,000. But as the white paper suggests, right, that our target is to really cater to the rest of the population, right? So 700,000 is about 1/5 of the adult population. And that suggests that there's a very large segment out there who are currently not reached by us or not participating in our programs. So the partnership with the general practitioners, GPs on the ground, in reaching out, right, to the additional segments of the population, especially the elderly, onboarding them and so on, gives us tremendous opportunity to bring more people on board onto healthier lifestyle activities.
Right, so we're talking about, in terms of HPB's role in this, we're also talking about this very interesting concept called social prescriptions. It's not something that we hear very often. And I think it involves, doctors sort of prescribing activities that people would have to go on in order to keep up their health and make sure that they continue to be illness-free as far as possible. And then they refer them to HPB for activities and so on. Give us an insight into what some of these activities may entail and what sort of engagements are being done with your partners in order to make this come to life.
Okay, so the activities are mainly those that are evidence-based, which contributes towards addressing some of the key issues, whether it's high blood pressure, high blood cholesterol, obesity, or diabetes. Right? And we know from evidence and studies that physical activity, watching diets, stopping smoking, as well as taking care of mental wellness and so on. Those are all contributory social factors, right, that help address some of these key challenges, which is what Healthier SG is aiming to achieve, right? So in terms of the partnerships on the ground, we are working with our fellow agencies. So those include Sport Singapore, People's Association, the Agency for Integrated Care, to bring together the various physical activity related or healthy lifestyle activities into Healthy 365 so that citizens and residents will have an easier time finding activities around their neighborhood and that they can participate.
So give us a sense of, for example, how it would pan out in real life, right? So if for example, if I'm diagnosed with high blood pressure at my local GP, does he then tell me, hey, you need to go to Sport Singapore or you need to go to, the National Stadium and take part in this particular event at a certain date and time?
That could be one example. So for someone who has a high blood pressure or maybe obesity and so on, indeed, then the social prescription is likely to revolve around more physical activity, right? And these physical activities can be then kind of localized to where the person is, right? So for example, if the resident is staying near a stadium, right, then very naturally, the prescription could look like exercise 3 times a week, right, at your neighborhood stadium. Or if it's someone working still at a workplace, it could be referrals to workplace health activities as well. They are being organized by HPB together with businesses and so on. So the shift is really then taking national level programs into the communities, right, so that residents can find something nearby, right, and when it's near, it's easier for them to get on board and to do it on a regular basis.
Oh, interesting. Now, a substantial part of the health plan is supported by the Health Hub, for example, Healthy 360 apps as well. But I'm wondering, is more better? Because you really have to be sure that the platform is robust enough. You have to be sure that there are enough people that sign up to make any app effective in what it does. And you've only got that, I'm not sure even how much of that 700,000 are signed up. So what are your thoughts on that?
So our thinking is this. Residents should be able to choose what makes sense for them and it suits their lifestyle. And we know that today, it's not just Healthy 365 on the market. There are also offerings from Apple, from Fitbit, from Garmin, and so on. And what we have done is to make Healthy 365 interoperable with these other platforms. So if you happen to be a Fitbit user, right, which is owned by Google, you can track your activities on Fitbit, and back end, Healthy 365 can sync with Fitbit. And so the app will then record what activities you have done, the heart rate that you have achieved, and so on. Right? So the data is not lost, it's actually captured under Healthy 365. And when the resident then next checks in with the GP can then look at what you have done. Yeah.
So I just want to bring my own experience into this conversation. I have a smartwatch, it tracks my fitness levels, and then using an app I can exchange it for vouchers and whatnot. So at the beginning I was very enthused and I was very up for it, and I got my $20 voucher and all that. I guess the challenge is sustaining that effort, right? After a while the novelty wears off and then people sort of lapse back into their normal routine. What are HPB's plans in terms of galvanizing the population to ensure that they then follow through on all these plans that are being listed out? Because who's going to take people to account if they don't go and do their 5-kilometer run, right?
Yeah. Ultimately, what we're after is for people to discover the intrinsic motivation behind doing the activities. As you said at the start, people may be attracted by health points, right? Which is our way of incentivizing and nudging behavior. But that shouldn't be the end outcome of it, right? Because if that is the only thing that matters, when the incentives stop, then the participation also stops. But what we have found is that for people who have sustained the activity over time, and if there is a feedback loop, right? So after doing it, I discovered that I've become healthier, right? My blood pressure has gone down, right? Or my weight has gone down. And those are good outcomes. I think that feedback loop is absolutely essential to helping people sustain the habit, because they can see that when I'm doing all these things, there are real tangible things that's happening to me in terms of my state of health, right? And my ability to enjoy a better quality of life, right? So yeah, to your experience is, in Healthier SG, what will happen is that with the regular check-in with the GPs, the GP and the resident can jointly take stock. What have you done and what's the outcome for you?
That's what I was thinking. You probably run more before you see your GP, right? Well, we have to leave it there for now, but we do appreciate you sharing with us the plans coming up. And we've been speaking with Tay Choon Hong, who is the CEO of the Health Promotion Board.
Thank you.